Okay, so patient assessment, and this is kind of the theoretical discussion to actually kind of what's a skill that you guys ultimately will perform. So, but this is kind of the basis for making those decisions. Okay? So, actually, all right. So, why? What does patient assessment mean? What are we trying to do?
Determine the proper care.
There you go. Yeah, ultimately, absolutely, right? So one, we need to go through a series of questions and examine the patient to figure out what's wrong so that then we can therefore determine what is the proper and appropriate care. Excellent. So if we don't do a good job at that, what happens? Right. Ultimately, we may not get the proper care. In fact, we may actually cause some harm, right? So because if you fail to do certain things, right, you can actually cause harms. If you don't ask them if they're allergic to something and you give that to them, we may be creating a bigger problem than what we already had. All righty. So basically, involved in patient care, we go through a series of phases that we get through, right? So there's what? 1, 2, 3, 4, 5, 6, 7, 8, 9, whatever they are, right? We're going to run through this list. This is basically kind of running through a call. This is the process by which we kind of think and get to where we're at. Right? So we talked about why it's important to necessarily develop. All right. So when you do this, right, at first you're going to look at this and go, this is all a bunch of stuff. You need to become very methodical about how you do it. Okay? With any skill, whether it's a golf swing, throwing a pitch, whatever it is, you need to be able to do the same thing every time. Right, so you watch the basketball players and they go up to the free throw. They have their little method about how they do it. They bounce the ball, they spin the ball, they think about whatever, they focus, and there's a process. Batters do the same thing. They swip their bats and turn their hats and whatever it is. There's a process to do it. Develop that process. Whatever your process is, develop the sequence. Because when things start to go downhill, you need to basically be in this mode where you don't even think about what you're doing. So start thinking in terms of that and basically do it the same way every time. Okay? Because if you do that, when something occurs and something goes wrong, you don't skip a part. You learn how to go back and catch the whole thing. Okay? All right. So with patient assessment, basically we start with the scene before we ever get there. Right? So when you arrive on scene, we kind of need to start paying attention. Right? Because little things like if you're at a car accident, the big tractor trailer that's carrying the billions of gallons of gas having a leak might be important. Okay? The fact that the big tractor trailer is carrying radiation material might be important. Okay? So before we get there, we got to make sure, right? So the guy that has the gun that shot the guy, it might be important to note that because you generally don't want to walk up and start treating him and go, "I shot him for a reason." Yes, sir, I bet you did. Thank you. I'll be over here. Okay. Yeah. Okay. So scene size up basically begins. So how do we know that we have a call? How do we know we have a problem? Typically. Dispatch. Right. So somebody calls 911, dispatch tells us that, hey, you should go over there. Right? So dispatch collects the information. And basically what they kind of get is generally what's wrong, what's going on, what's the patient, how old's the patient, what's happening, what are the general complaints, what are the general problems. And they tell us this information. Okay? So we played the game about, hey, I whisper something in somebody's ear and it goes around the room and ultimately ends up over there. What generally happens when it gets to the back of the room? Right. So we got to recognize that the dispatcher is feeding us information. If they're not understanding the patient correctly, we get off on the wrong track. There's lots of times where you're told that, hey, the patient's having chest pain, and you walk in and go, hey, your chest is hurting. They go, no, it's my foot. You go, you sure? Yes. Okay. Back up. Yep. Right. So it is. Little things happen. Folks misunderstand stuff, right? So location, incident, injuries, right? So as we continue, we can get in other information. So generally kind of what happens is the dispatchers will gain just enough information to kind of figure out where are we going and what's the nature of the call. Then they dispatch us. So we get en route. while we're doing all that, they're continuing to ask the questions. So now, as we're going en route, the dispatcher can come back and say, hey, here's some additional information. Or actually now a lot of them where we're getting at is the computer dispatch stuff. We basically can look at and access the dispatcher's screen. So as they're typing in information, we can see it on our little screen. So we actually see what they type in, so which works wonderful. Okay. But other stuff that we can get to that, as we're starting to go, right? As we get close and we start to see this big billowing smoke, we can kind of go, I bet you there's something up to this. Okay. Or, you know, you get this green cloud of smoke and there's lots of people lying down on the ground. You go, let's back up a little bit, figure out what's going on. Okay. So look for things, right? Smoke, fire, right? Power lines, railroads, water industry, what's there, right? So you go into Wilson Art. Is that a good place to be? Safe place? Does Wilson Art have anything that would concern you?
Yeah, lots of formaldehyde.
Lots of chemicals, right? Lots of stuff. And so, but it's a, you know, they have a good reputation. They have good safety practices, but they're humans. We make errors. Things happen. So we can walk in kind of going, what could hurt me here? I need to kind of pay attention and see what's going on. Okay. All right. So again, overall, what's the scene like? How many patients are there? Where are they at? Okay. So as you look at this, kind of what's your general impression of this? If you arrived on scene, what are you thinking? Right. So we got a car accident. What else do you notice?
How many victims? Firefighters are there.
All right. So yeah. So we got some public safety folks that are already there. What else did you say? Yeah. All right. Because look, there's kind of the radiator and the engine. Okay, so yeah, so maybe there's stuff under there that we need to kind of worry about. Pardon? Could be. Yeah. So, yeah. So overall, right? We look for, and ultimately, originally, when you get out, and basically just kind of memorize this for now, but you want to know the number of patients, the mechanism of injury, the thing that happened, right? Do I need any additional help? Okay. And number of patients, scene safety. Yeah, and is it overview, is it safe? Do I see any hazards or problems? Okay. So before you even get out of the truck, you should start looking for that and answer those questions in your head. Okay.
Looks to me like his front wheel disappeared.
Yeah. All right. So what about this? Any problems you see here? Yeah, right?
The roads are wet.
Yeah, right. So I'd all be going, whoa, wait, okay. That line may be dead. It may even be just a cable line. But it could be a power line. So until we figure all this stuff out, back up, get out. All right? Yeah, so crowds, hazardous materials, electricity, all sorts of stuff can be. So in general, you got to kind of learn. And it's not something that you've probably been trained to do. You kind of got to develop these senses. Okay, so start kind of sweeping, kind of going, well, what could jump out of here and hurt me? Okay. All right. Now, your first priority is to protect yourself. Okay. Your next priority is to take care of your partner. Your next priority is to take care of other rescuers and bystanders. And then in the end, we have the patient. Do y'all agree with that? Well, why is the bystanders more important than the patient? There you go. That's it, right? So I want to prevent anybody else from getting hurt. Then I can focus on the patient. Right? So yeah, so you can get there. And that picture before, you can go, wait a minute, guys, back out, get out. Hold on, let us work through this. Let's figure out what's going on before you get hurt again. So good. Okay. So do I need any other additional resources? So if I've got 4 people that look injured, I probably need some more ambulances. If I get there and the thing's on fire, fire department, right? So hazardous materials, police, whatever the specialized rescue units. So depending on where you're at, yeah, figure out what you need, right? Yeah, so you need the hostage negotiating team. What is it you need? So figure out what you need and get them en route because it's going to take them a while. So if you're coming up and you're seeing that smoke cloud for a while, you may go, hey, is the fire department coming? So, because we're seeing smoke. So you can, the earlier you can get them there, the quicker they can get there. Okay? Now the other part, BSI, and actually you guys will learn the little magic BSI wave. Okay? So before you ever even touch a patient, do anything, put on your protective gear. Okay? So, and generally that encompasses gloves at a minimum, but glasses, masks are other important stuff too. Okay? In general, y'all see in the hospital where they have they get in all the gowns. That we have those, but those get kind of cumbersome. Generally, our uniform is kind of our barrier. You may get blood on your uniform. Okay, fine. We can go back to the station, clean it, whatever, change however we need to do. Okay. All right. Yeah. So protective clothing. So if we're going around that accident scene, and I'm just in my regular work clothes, what is it protecting me from? Kind of just general abrasions, but depending on how thick the shirt is and how thick the pants are, it may cut right through the pants. So if you're going around that where you got a lot of metal, you probably need to have those heavier coats on. You don't need the fire suits on, but you need that thicker material. So generally something like some sort of coat or barrier on there. Okay, extrication equipment, gloves. So if you're working again in the cars where we're dealing with metal and glass, those little rubber, vinyl, latex stuff don't stop you from being cut. Work gloves, the leather gloves, will stop you from being cut. If you're in an area where you're worried about stuff falling, we need helmets. Right? Boots in general, as part of our uniform, we have some sort of safety protective boot on. Eye and ear protection, depending on what it is. Okay, so is this eye protection? No, right? Yeah. So it's the corners aren't covered, so I can get in between stuff. So these are not safety glasses; these are just viewing glasses. Okay. And depending, so I guess depending on where you work, if you're on Miami Beach or something, we may need some protective sunscreen or other stuff. Right? All right. So again, kind of we get there and look for violent things. Unfortunately, I've seen a couple places where the crowds got a little overwhelmed and they didn't like how we were treating folks, and it got a little nerving. So, but kind of pay attention to that, right? Because it's a gang fight, and you got they're upset that this is occurring. They may not be upset at you, but you're now in a dangerous situation because if somebody else comes by, now there's another fight going on. Domestic disputes. So if there's a family fight, anybody know how many? So ever watched kind of the police when they go in to domestic areas? They don't go by themselves. They go with two, because ultimately what happens is they go by themselves, and the wife goes, okay. So the husband beat the wife. Okay, so the cop says the husband's going to jail. Now the wife jumps the cop because she just wanted him to stop. She didn't want him to go to jail. So now the cop has to protect himself from the wife too. So that's why generally they go in pairs so they can kind of protect each other. So recognize that when we go into there. Okay? Large gatherings, crime scenes, all that kind of plays a role. Even at kind of concerts, those large mobs can become dangerous. Okay? Behavioral emergencies where there's kind of some psychological issues. Again, look for kind of, do we know what happened in the past? Do we have any history? Do we have an idea what's going on? You know, again, look at their posture, right? Because I'm going to do, man, versus, you know, like that. You're kind of, the body language is different. You're kind of going, okay, he's upset. Maybe I need to back out. If the voice is getting louder and louder and louder, okay, he's upset. We need to back out and get safe. Okay? So watch those little clues. Okay. Yeah, so your safety is of utmost importance. That's the first thing. If you're not safe, make it safe, or get to where you can make it safe. Okay. So scene safety stuff makes sense? All right. Now, we're going to do the initial assessment, also called the primary survey. Okay. Now, this whole point of what we're doing here with the initial assessment, get there, okay, is what we're trying to find is, are there any immediate life threats, and can we fix those life threats? Okay, so things like they're not breathing. If you don't breathe, you're not going to be living for long. So our goal is to come in and find the immediate life threats. Anybody taken CPR in the past couple months? Okay, so what was a sequence of things that you learned? So, okay, well, we did ABC. So, but anybody do it in the past couple months? Is it still ABCs?
First it changed.
All right. So what is it now?
CAB.
CAB, right? CAB. Okay. So now you're kind of caught in this mix, unfortunately. Okay. You're correct. As of whatever April, whatever the date is, the American Heart Association said, switch, we're doing the new education. So anybody that learned ABC, that's kind of an old, well, actually you may be okay. ABC is kind of the outdated way to do this, to approach this. Now what they're saying is do C, then airway breathing. So check for pulse, then do airway breathing. Okay. Your certification exam, the National Registry exam, isn't flipping to CAB until January. So when you take your certification exam, the process is ABC. So when we go through this course, this semester, it's ABC. If you come back and visit us next semester, we're going to be CAB. Because when they finish, when we start in August, they're going to finish in December. And when they take their test in January, it's going to be CAB. There's nothing wrong with ABC. It's just not the thing that they're doing now. So you're going to see a mix of stuff. You're going to see folks practicing CAB. We're going to teach you ABC. We're going to go through the process of ABC. Does that make sense? We want you to be able to pass the certification exam and not confuse you. So even though, yes, you've learned CAB, it's a good thing. Recognize there's change coming. Understand the differences, but the whole process that we go through is ABC. Okay? All right. All right. So when we walk up, we'll get through this real quick. All right. So we get a general impression, right? So if I walk up and you come to me and I go, "Oh man, I got chest pain." Okay. Am I really believable? Does my voice right? So, but if I go, "This hurts. This hurts. This hurts." Okay. That's kind of your general impression. What does the patient look like? Do they look like they're in pain or distress? Do they look like they're having a problem, right? So if I walk up and I go, "How's it going?" versus, all right, that's your general impression. Your general impression is basically, do you feel that they're sick or not sick? That's kind of what we're trying to figure out. Okay. So look at skin tone, look at breathing. We got to take in all those things, right? So that's what we're trying to figure out. So we get the general impression, we get the chief complaint pretty quick. Okay. From there, we also kind of want to figure out mental status real quick. Alrighty. So if you walk in and go, "Hey, how's it going?" I go, "Fine." Okay. My mental status is good. I'm responding to you. Okay. But if my eyes are closed and you walk in and you go, "Hey," and I open up my eyes, I'm not truly alert. What I'm doing is I'm responsive to verbal stimuli, which is what V is. Okay. If you now then go pinch me and cause pain in my eyes open, or I move my arm, then that's responsive to painful stimulus. If after pain nothing happens, then I'm just unresponsive. Okay? So these are just kind of general levels of activity. Right? So either I'm awake, I'm looking at you, I interact with you before I even walk in. You speak to me, my eyes open, I move, I do something, or you cause some sort of painful response and I respond to that. Those are the levels. Okay? So this is the AVPU scale. Okay. Now we identify life threats. So the first thing again, airway. Right? So we maintain an open airway because the idea they have to have an open airway in order for them to be breathing. Okay? So we'll talk about a couple things there. So there's, as we go through the different processes, we'll talk about how to do because the CPR stuff you guys learn head tilt, chin lift, right? Mm-hmm. And then there's also kind of the jaw thrust. Okay, so those are the two ways to open up the airway. And our goal is to really open it, to clear it, and to make sure it stays that way. So what can be in the airway? That's a problem. What did you say?
An object.
Okay. Yeah, so the tongue, fluid, right? So there's blood or saliva in there. Yeah, I have a hot dog or something in there, right? So we want to get all that stuff out. So if there's fluid or blood or other stuff, so we can suction that out. If there's a hot dog or something, we can pull it out. If the tongue, then we can do the jaw thrust or the head tilt to make it pull back. Okay? Now we do breathing and kind of the look, listen, and feel. Now the new stuff, we're getting away from the look, listen, and feel. But for what you guys, look, listen, feel. Look at the chest. You see it rising and falling. Do you hear anything? And do you feel any air movement? Okay. The new process, basically what they're saying is, look in general. Do they look like they're alive or not? If they don't, then go check their pulse. So we're just going straight to see. We just kind of do a general cursory survey. Okay, so but the way we're doing it is airway breathing. We look, listen, and feel with the breathing. Okay. If we need to at this point, bare the chest. So if they're having obvious respiratory distress, it looks like they're having trouble breathing, look at the chest, because if there's a big hole here, we want to fix that. Okay. So you can then cover that up and they hopefully may help them breathe better. You can actually even listen to the breath sounds here. Because if they have wheezing or they have fluid in the lungs, we want to fix that. Okay. Alrighty. And then circulation. Okay. So check for major bleeding. Okay. Check for pulses. In general, you have a radial pulse. They generally have a blood pressure of about 80. A carotid pulse, they generally have a blood pressure of at least 60. Okay. If they're unconscious, start here. Start at the lowest common denominator. If you check for a radial pulse, they may not have a radial pulse, but they could have a carotid pulse. So don't get confused. So if they're unconscious, go straight here. Okay. Also, the other part is skin color, skin temperature, cap refill. Okay. Normal, healthy skin should be pink, warm, and dry. Patients that are in trouble have pale skin. It looks white. It's cold and diaphoretic. Okay, so sweaty. Okay, cap refill. What's cap refill? Right, so circulation. So if I push on this, I let go. Good cap refill is that fills back in within 2 seconds. Poor cap refill, it takes 5-6 seconds. Okay. All right, so we talked about that. All right, talked about skin temperature, skin condition. All right, so we'll stop there. All righty?